Chairperson and members, firstly, I would like to warmly thank you for this opportunity to address the committee today. As the Chair has said, my name is Dr. Suzanne Crowe and I am currently President of the Irish Medical Council. The Medical Council is the statutory body which is responsible for the regulation of doctors in Ireland. The key objective of the Council is to protect the interests of the general public in their interactions with registered medical practitioners, while also supporting these doctors. The Council protects the public by promoting and ensuring high standards of education, training, conduct and competence among doctors who are registered with the Medical Council. The Medical Council maintains the register of medical practitioners, the register of all doctors who are legally permitted to undertake medical work in Ireland. The Council also sets the standards for medical education and training in Ireland. It oversees lifelong learning and skills development throughout doctors' professional careers through its professional competence requirements. It is charged with promoting good medical practice. The Medical Council is also where the public may make a complaint against a doctor. The Medical Council's remit is set out in the Medical Practitioners Act, as amended in 2007, and other relevant legislation. As part of its role, and to support doctors to meet these high standards, the Medical Council produces guidance on matters related to professional conduct, ethics, and aspects of practice. In November of last year, the Medical Council published the 9th edition of its Guide to Professional Conduct and Ethics for Registered Medical Practitioners. The guide seeks to support doctors by providing principles-based guidance on how to best work in partnership with patients. It covers a wide range of topics and scenarios likely to arise over the course of their professional careers. The guide is also useful for patients as it clarifies the standards of care that they should expect from their doctor. This guide came into effect on the 1st of January, replacing the 8th edition. In preparation for the drafting of the 9th edition of the Guide to Professional Conduct and Ethics, a comprehensive public consultation took place, as well as a roundtable targeted consultation with representative stakeholders. All feedback received was utilised to inform the drafting of sections and paragraphs in the 9th edition of the Guide. As with previous editions, and as mentioned, the Guide seeks to support doctors by providing principles-based guidance on how to best work in partnership with patients. The Guide begins with an introduction, and I'm hoping that many of you have a copy there in front of you, and includes some instructions on how it should be used. It is important that the Guide is read completely and not any section in isolation. As outlined in the introduction, the Guide outlines general principles that you're expected to adhere to and observe, as well as more specific guidance in relation to identified aspects of practice. The Guide, however, is not a legal code. The Guide does not aim to address every clinical and non-clinical situation that arises in practice. However, understanding and applying these principles will assist the doctor to safely navigate situations that arise in professional interactions. The Guide also outlines that you have a duty to comply with the laws and regulations pertaining to your practice. Your practice and conduct will also be informed by professional, clinical, and organisational policies and guidelines. Furthermore, as stated in the Guide, the guidance should be read in conjunction with all relevant policy and legal developments during its period of application. When drafting the 9th edition, the committee considered existing and newly enacted legislation and how it applies to the protection of the public from medical, regulatory and legal perspectives. In relation to the direct work of the committee to consider and make recommendations for legislative and policy change relating to a statutory right to assist a person to end his or her life, assisted dying, and a statutory right to receive such assistance, it is important to point out at this point that the Medical Council does not have a position on this topic. I feel it may also be of benefit to the committee to address some recent commentary related to one of the changes in the new edition of the guide. A number of paragraphs in the 8th edition of the guide were edited, merged or removed following the consultation and drafting. One such paragraph in the 8th edition of the guide does not appear in the 9th edition, namely, you must not take part in the deliberate killing of a patient. This removal has been misinterpreted by some. The guide states that the medical profession must comply with and operate within the law. As per legislation, it is illegal for all individuals, including doctors, to take part in the deliberate killing of a patient or to assist a person to end their own life. The removal of this paragraph was not the Medical Council taking a stance or paving the way for any possible future change and should not be interpreted in this way. The removal of this sentence does not diminish the law. In more broader terms relating to the guide, there is a detailed section on conscientious objection. Paragraph 42 details how a doctor may refuse to provide or to participate in a lawful procedure, treatment or form of care which conflicts with a doctor's moral values. I have provided the committee with the text of the conscientious objection and end-of-life care sections of the guide, in addition to a full copy of the guide. In conclusion, I would like to paraphrase the guide by saying, doctors hold a privileged position of trust in society. To maintain this trust, doctors are expected to demonstrate professionalism through application of the required skills and knowledge and adherence to high standards of professional conduct and ethics. The Guide to Professional Conduct and Ethics outlines the values and principles that underpin professionalism and good medical practice in the interests of patients and the broader population. It specifies how these values and principles apply in various aspects of doctors' professional practice, for example, with patients in practice settings, in the broader community, and with colleagues. Patients are individuals with diverse needs. The guide acknowledges their right to be treated with dignity and respect, and to participate in decisions about their treatment and care. Given the constantly evolving healthcare environment, the Council intends over the next year and beyond to issue additional guidance on a range of different areas. With the evolving nature of the practice of medicine and the delivery of healthcare in Ireland, the Council will be regularly reviewing what additional support or guidance the practitioners may require to supplement guidance already available in the guide and to align with national health policy developments. Once again, I would like to thank the committee and the chair for the invitation to attend today.
Thank you.